Hi, Bruno Jr. here. Our podcast, Busting Addiction and Myths, is sponsored by SafeHouseRehab.com. SafeHouse believes that traditional treatments fall short of the needs of clients who face the modern problems of addiction. Modern problems need modern solutions. Multiple addictions, multiple relapses, multiple triggers, and cheaper and more powerful street drugs set up unprecedented challenges facing treatment centers. What is needed is a more sophisticated approach, a better way forward. There are 3 reasons to choose our progressive modern treatment program. 1, a more sophisticated intake process. 2, technology proven to enhance recovery. And 3, the most robust aftercare program in our sector. To learn more, visit us at SafeHouseRehab.com. This is Busting Addiction Season 13, Episode 11. And we call this episode, U.S. Doctors Were Untrained to Diagnose Addiction Until Now. Legislation in the works for 3 years finally passed both houses of Congress in the USA. It's called the MATE Act, M-A-T-E Act, which stands for Medication Access and Training Expansion Act, and it promises to revolutionize how medical schools provide training and education on how to diagnose and treat those with a substance use disorder. More than 107,000 Americans died of drug overdoses last year, setting another tragic record in the nation's escalating overdose epidemic. It is estimated that 70% of those overdose deaths came as a result of opioids, and that the vast majority contained the latest death chemical, fentanyl, now sprinkled into everything from heroin to Percocet. To make matters worse, only 1 in 4 healthcare providers, that is doctors, nurses, and other clinicians, said they received any training on addiction. And more than half of them believe that opioid use disorder, or OUD, is untreatable. That level of prejudice is hard to believe, but it's there for all of us to see. The passing of the MATE Act is a critical step forward in treating addiction like a chronic disease. It also demands evidence and science-based treatment for millions of Americans who currently struggle with addiction. This is a systemic change, a fundamental change that requires medical professionals to get training that 3/4 of them never had before. It's a major step in helping to stop an epidemic that has cut short far too many lives that could have been saved if a medical professional could have identified what they were dealing with. For addiction comes in many disguises. That's part of the cunning, baffling, and powerful nature of this disease. Quoting now from Shatterproof, a not-profit dedicated to understanding the true nature of addictive disease and promoting education and legislation to support treatment, this is what they say. This legislation is monumental for families struggling to access evidence-based treatment for addiction, including parents like DDY, whose son was prescribed opioids after multiple surgeries, and subsequently he battled a 7-year struggle with addiction. The family had challenges finding a doctor who would prescribe medication for treating her son's addiction, and the boy passed away the day before he was scheduled to meet with a doctor who would actually treat him. No mother should have to walk in Didi's shoes, which is why legislation like this is so essential to ensuring healthcare providers know how to ensure patients receive the care that's right for them. To what we learned from in the course of our own recovery program and from listening to hundreds of recovering people tell their own stories is this. In their experience, they or their children presented to clinicians, like doctors and counselors, a case of anxiety, depression, bipolar, lethargy, or some form of mental abnormality that was caused by, but not attributed to, addiction or alcoholism. And in the vast majority of instances, the doctor or mental health counselor wasn't trained to ask the right questions or look for signs of addiction as a central issue. Instead, their patients were prescribed meds for anxiety or antidepressants or some combination thereof. So this is what we learned. 1, even to this day, 3/4 of medical professionals get no training in addictive disorders. It's sad but true. 2. The MATE Act, as passed recently in the U.S., will require all medical schools to include substantial training in identifying and treating addictive disorders, including alcoholism. 3. This does not mean that anyone looking for help from a medical professional will automatically get help from someone trained in addiction. Number 4, it will take years for the MATE Act to become embedded into medical schools. And 5, this does mean that one should look for a qualified professional, one who has a degree or certificate in alcohol or drug addiction AODA education. Our podcast is sponsored by SafeHouseRehab.com, a modern approach to recovery. To learn more, visit us at SafeHouseRehab.com.